So Laura, introduce Elizabeth to us.
So Miss Elizabeth, as I was telling you all, that she comes from Kentucky, and she has a very interesting story that I'm going to let her tell you, because it is, I couldn't really do justice like she's going to do. But what I want to say is that it's been also an honor to get to know her, to see her heart and her disposition. And we have been working just for less than 2 weeks. And the improvements that she has made have, I'm just beyond words. I'm so happy for her. I'm so thankful for, this opportunity. And this is all because of you two. And when I say that, Melissa, because that's how she was able to find Prescribing Life. So I'm going to let her really tell us her story.
Yes, welcome, Elizabeth. Tell us. I'm so excited to hear your story.
Oh, gosh, I was trying to think how to say this and not take up all your time here. Short or long version, but to get a better background of what I have going on, about 2009, working as a nurse in the NICU and also peds, and we get our seasonal flu shots every year, and got mine in 2009 of October, or actually September, but 2 weeks later, I was paralyzed from my chest down. And so I was diagnosed with transverse myelitis, which is
you're going so fast. Okay. 2009, you're a nurse. You take the flu shot. I want everybody to take the flu shot, which we're all up in arms about all this. Okay.
Right.
So so far so good, but 2 weeks later, you are paralyzed from the waist down.
Down.
From the chest.
Down. It affected my cervical spine from like C5 to C6, C7 to all the way to T2. So,
and they called it some big name. Say it real slow.
Transverse myelitis.
Transverse myelitis. Okay.
Transverse is for the direction, which is across the spinal plane, or horizontal is where it's the injuries affected. And also the myelitis is the inflammation of the myelin sheath that protects the spinal cord, keeps it, keeps all the nerves and blood vessels protected.
Okay.
So that caused a lot of nerve injury.
Okay. Injured it, inflamed it. Do you know?
Yeah.
Okay.
Go ahead.
It inflamed. Do you know what it did to it, or you don't know? Just it's damaged.
Yeah, it's just damaged. Basically, transverse myelitis is inflammation of the spinal cord. So it triggered it. There's really a lot of different reasons that cause it. A lot of causes. It could be anything from viral, bacterial infections, autoimmune diseases, vaccines. So yeah.
But you tried everything.
Yeah, I have tried everything. I have spent tens of thousands of dollars on just traveling to Baltimore, Maryland, for example. I've been there for 2 or 3 times for physical therapy and outpatient. I have tried ozone therapy. I have tried IV supplementation, bone therapy, stem cell. I mean, I feel like I've tried it all, and I have prayed for 12 years.
I'm sorry. I want to back up a little bit. Okay. So, me, I'm just starting to imagine this. Okay, if I were to get paralyzed from the chest down, what happened? It just your body collapsed, and then you had to be in the bed. What did you do?
Right. So immediately the afternoon after I got the flu vaccine, I started having flu-like symptoms, and it put me in bed all weekend. I think I got it on a Friday, and I remember telling my husband, like on a Saturday or Sunday, I was laying around just wiped out. And I said, I just feel like I'm paralyzed. Like I want to move my legs, but my brain's telling them to move, but they're not. And they're just kind of, moving slow. So after about 2 weeks, I noticed I was having back pain, neck pain I never had before. Just my feet were so tender, I couldn't stand. And at the time, I was working 2 jobs, and I was running like a flu clinic for our pediatric patients where I worked. And I was on my feet a lot. I thought, well, nurses are the worst patients. So we just, chalk it off to being busy or, whatever. So I didn't think much about it, but it just got worse. And by that 2-week period, it was falling on another weekend. My neck was so stiff, I couldn't turn it to the right or the left. And I remember taking my son to daycare like following Monday and dropping him off, getting the vehicle. And I went to look a certain direction. And it was like I immediately had this Charlie horse sensation between the back of my shoulder blades.
Yeah.
It just locked me up. I just kept driving. And then it got so bad, I thought I was having a heart attack because my whole left arm was going numb. I was having chest pains, just getting a little confused. And so I pulled off the side of the road. They called an ambulance, took me to the hospital. They treated me for local hospital, treated me for like a muscle pull, or told me to follow up with a chiropractor and put me on muscle relaxers. That didn't do anything. So overnight, things just got worse. I started dragging my left leg, and I was losing control of my bladder. I couldn't urinate anymore. So I knew something was bad wrong.
Yeah. This is not a muscle pull.
No. And I tried to tell them that it was something more. And I told them I had a flu shot, and this all started from that. And I'm normally pretty healthy. I had like one autoimmune thing that popped up prior to this, but normally healthy, active, And so anyways, that next morning, my husband, it got so bad, he took me to the hospital, and they admitted me. And I told him again, I was like, I think this is what's the cause, because I thought I was getting Guillain-Barré, which is real similar. You have the paralysis and things. And finally, I had an ER doctor finally listen to me, because they were sending me for cardiac testing. And I'm like, that's not it.
Well, the thing is, you know what you're talking about, because you're a nurse.
Yeah.
You have all this training.
Yeah.
Because me, I'd be like, I wouldn't even know what to say.
Right. It was pretty frustrating, but finally somebody listened, and they admitted me finally, and within 24 hours I was totally paralyzed from my chest down. I lost all fine motor control. It was almost like I had a girdle around my torso. It was real restricted, and everything felt like it fell asleep, heavy. You know how your body, when something falls asleep, it feels heavy. And my legs, they feel like tree trunks, or like, 100 pounds extra weight on each side. And I just lost just everything overnight. Basically, I went from fully functioning an adult to an infant state in 24 hours. And so
Wow.
had to have, my family and the nurses and things have to give me a bath, brush my teeth, wash my hair, do my personal care, toiletry, and just, it was a nightmare. But my life was totally turned upside down, my family's life, within 24 hours.
Wow.
So they ended up a couple of days later doing an MRI and diagnosing me with transverse myelitis. I'd never heard of that before. Being in healthcare, never heard of that.
So they did identify it fairly quickly what had happened. It's very rare, from what I understand.
Yeah, right. It's very rare. I think there's like 1 to 8. Let's see. I think it's 1 to 8 cases in a million. So it is fairly rare. It was rare back when it happened to me, but it's becoming more prevalent. I'm seeing it more and more with vaccinations, especially with this new one that's come out, which is a total different story. But so I have had a lot of residual since then. I did like actually I was in acute care for about 9 days in the hospital, and then they sent me into inpatient rehab for about 12 weeks. And I did OT and PT 3 times a day, 6 days a week, to try to get,
They weren't really hitting the root problem.
No.
And so ever since then, you've been trying this and trying that and trying the other.
Just symptoms. They put a Band-Aid on it and think everything's going to go away. And at one point I was on 32 different medications, pills. I don't even know how I functioned. I really don't. So
you're obviously, you couldn't work. What did you do? Just stayed and did your physical therapy and stayed in the bed?
Pretty much. I did the inpatient rehab, and then they discharged me home enough where by that time I was able to use a wheelchair. I was able to do a little bit on my own, but bowel, bladder, I had to have help with my family.
And at this point, you're like 25.
Yeah. It's pretty crazy how everything went. But so my mom, actually, it worked out. Thankfully, God knows what he's doing. I just don't. She ended up being laid off of her job for 2 years, and she's took care of me while my husband was able to go back to work and, support us. And so she did pretty much everything for me and my family. And we had just our little boy from Guatemala. He was only
that you cut out from it. You adopted a little boy.
Yeah, we had adopted our son from Guatemala. He was 3 when this happened to happened to me. So this is all he's ever known, about his mom. He's 15 now. So,
So what would tell us a typical day? What would you like when over the past 11 years, what would you do when you would wake up?
when to get a little bit more mobility back, I was able to start walking taking my first steps about 3 months after my injury. So little by little, I started to gain a little bit of function back. But the chronic pain is always there. It's just the neuropathy pain is from my abdomen down to my toes. I tell my husband, I feel like I'm standing in hot boiling water all the time, or either freezing cold. It's not, if there's no balance, and there's nothing that I've been able to find to calm the nerves down, nothing. And so my typical day would be a lot of time in bed, because I think over the years I've had a lot of falls, a lot of injuries. And then I have a bowel program I have to do every day that's totally exhausting. It can take up to 2 hours. So that's one thing I have to get out of the way immediately before I can do anything else. I'm a person that can't stand to focus on myself, and it's been really hard because I've always been the caregiver. And so it's been really tough to have to focus back on myself. And
I can't imagine. Imagine.
Yeah. But I stay in bed it got to the point before I started, before I saw your video about your mom, I was in bed probably a good 8 to 10 hours a day. And it depends, because of the chronic fatigue that I would have as well. It would depend on what activity I would be doing. If I would maybe thinking I had a good day and be up a little bit more, I would have to pay for it, like be in bed for 2 or 3 days. So there is no.
But you would pretty much, when you're saying you were up, were you in a wheelchair?
No, I'm on a walker, like a rollating walker, one that you can sit down on if I need to rest. I do use my cane sometimes, depending on the distance I have to walk. But when I ambulate, I'm very spastic. My legs have really tight tone. Matter of fact, about a year after my injury, I ended up having to have surgery and getting a intrathecal baclofen pump put in my left abdomen, which is about the size of a hockey puck. And it's made of titanium, and it's probably about 1 inch thick, maybe. So,
Elizabeth, if you let me interrupt, I'm just going to translate what that means.
Yeah,
we're all on the same page. Basically, what that is a device that will allow medication to be released from her inside her body, in her abdomen. So she's basically having the pain medication all the time releasing to her blood and to her system.
Okay. Thank you.
Go ahead. Sorry.
that was the most relaxer. It has like a catheter attached to the pump, and it tunnels under my abdomen around to my spinal cord into the intrathecal space, which is like where your cerebral spinal fluid is. Right. So I'm constantly getting a constant dose of that. And no matter how much I've had my doctor, pump up the dose when I'm feeling really spastic, it just never seems to give me the relief. I don't sleep good. Wow. It's just been
You've been through it, girl. You've been through it. Wow. Yeah. So, but you would be in a walker, but you had to be very careful that you didn't overdo. And this is all your son has known, is for you to be in this situation. So, okay. So let's fast forward to, you saw the video where we're talking about my mom. You said, hey, this is crazy, but let's get in the car.
Right.
We'll go to Texas.
I had put it off for a little while because I was like, I have to look a little bit more into that, because you get so skeptical anymore. And I've spent so much money and so much time and, effort trying to find relief, trying to find an answer. And I've just been praying lately, God, please send me something, because it got so bad that I just mentally, I was feeling myself just the brain fog from the medications I'm on. I'm on pain medication as well as Lyrica, which is for neuropathy, which makes you crazy and swell.
Right.
So I was like, if I don't do something now, I don't know where I'm going to be in like 3 months. I just got so desperate. So I was like,
wow.
So Lord, just kind of pulling, nagging Elizabeth, pay attention here. This is something I'm sending your way. You need to listen. And so finally I made the appointment and set it up. And from then, it kind of took off, and my husband and I came down about a month ago for a week.
You drove down.
Yeah.
Flying is probably impossible.
Well, I did fly this. I'm actually in Houston right now,
Oh, okay.
getting treatment. So I'm on my, what am I on, Laura? Like
This will be today your 7th treatment. That was
okay.
your 7th treatment. Yes.
Yeah. So anyways, we couldn't stay any longer than a week. So we packed up and went back. And I was by that 5th treatment, the
Okay,
first
so hang on,
treatment.
okay, so first treatment. So you get to see Laura, say hi, Laura, and
Yeah.
she's like, strip down. We're gonna
Yeah.
start shooting you. Okay.
Yeah. Yes. So yeah, she focused a lot on my abdomen where I was having a lot of pain. I think my pump and this, I got a 6-inch scar on my abdomen, and it's been giving me heck. So
I bet.
she focused a lot on that, and I hadn't. It had hurt so bad nonstop for like 6 to 8 months. I'd been to the ER about it like 3 different times, spent overnight, in the hospital trying to figure out what in the world's going on. So she treats me and I get immediate relief. I cried. I know she's probably tired to see me cry, but I just got so see, I thought
That's so beautiful.
um,
That's so wonderful. That's so wonderful.
to be in that pain is very difficult mentally. I don't know where I would be without my faith, really, but
wow.
Wow. It was getting impossible because I even thought, never have I wanted to hurt myself by any means, but I was thinking, just to be out of this pain for a little while would be
right.
true, just a little bit of relief. And when I got that, it was just like, whoa, I just was blown away because I wasn't expecting it.
Right. And my mom was just in this situation from like February until November, which seemed like an eternity.
Yes.
I can't imagine, 11 years droning on and trying this and trying that. And we already felt like this brain fog of,
yeah.
Is there any hope at all that for her life? And she was just feeling like, okay, I'm just hopeless. So I completely understand where you're coming from. And it's hard for those who love you to see you in this type of situation. So you're telling me she shot you and
she did. I was hugging her. I was like, I just can't believe the relief I got. And each day was a little bit like the layers just kept falling off. The nerve pain was like, it's usually on a 10 on a pain scale. And I think when it's tolerable, it might be a 5. But I mean, it was probably a 0 that day. And because I hadn't felt that relief since before I got sick. So
11 years.
Yeah. And by the 5th treatment before I left, I was totally pain-free. Totally pain-free. I knew I had some more layers and breakthroughs to get through, but totally pain-free by the time we left that morning to go back home. And
my goodness, this is 6 treatments. So you were having one each day. I know, I'm excited. Okay, so each day she was giving you a treatment, like because with my mom, for my mom's case, she was doing like every other day. For you, especially because you were having to go back home, so she's every day to do one. So what do you think? Okay, but I want to find out, what you did each day, because I heard it really changed your life like dramatically, but don't tell me that yet. I want to ask Laura to hold that, because I want Laura to tell me, what did you do? What's happening inside? What's happening?
Well, how much time do you have?
I know. I'm always like, show me the picture. I want to see what exactly. So basically the myelitis thingy it's not inflamed.
So transverse myelitis, like Elizabeth was saying, it is very rare. But at the end of the day, the world myelitis, anything, I think we talked about it. Itis, anything finished in itis, it means inflammation. So when we're talking about inflammation, neural therapy is great for that. So one of the first things that we need to do is definitely take care of the inflammation. What's happening when there is, inflammation in the spinal cord? Everything is going to hurt, but not just that. There's going to be a lot of signals that are being going to send to the body. So people are going to have numbness, and there is going to be also changes in temperature, right? Like you're going to feel different things like burning sensations and really cold. Also, the blood flow is going to be different in different areas. So we're going to have really red areas or really purple areas. That is going to tell us how much oxygenation is going into these different places. So basically, it's really imagine like, we're going to put it in very, simple terms. Like we have this wire and it's very thick and it has a lot of little wires inside, but it's sending information to your computer. If we put a clasp on it, or if we start, pressing it really hard, maybe it's going to break some of these little cables, or they're going to be so tight that the information is not going to go through correctly. So you're going to have some kind of distortion of the image, of the sound, etc. So that is what happens, in the nervous system as well, which is, like we said, is sending and receiving information. Once we find the right places where to go, and knowing the medical history of the patient, once we find those places, we can start seeing results. Everything depends on, the medical history, the symptoms that the patient is presenting at that moment, and we can see, great results. And I'm so happy for Elizabeth. I know we need, to work a lot more, but seeing not just her improvement in a pain level, but also, we haven't talked about that, but she's going to tell you about the way she's moving so much better now. It's amazing. So we're very excited for her.
Because Laura was talking about you, okay, in a good way. She was like, you got to hear about Elizabeth. So she said that you had not.
Yes, so I did.
That you'd not been able to go out to eat in years.
Right. I was pretty much becoming a hermit in my own house, just feeling more and more confined. My husband, anytime we would do anything with our son, it would just be just him, taking him, to go do whatever. I would try my best to get out, but every time I did, I would just be back in bed because of the pain. It was just so bad and so intense. And so yeah, I became a pretty big hermit, and just kind of wasn't able to spend time with family or friends. And I'm very outgoing, and always on the go before. And this has been really hard slowing me down. And I was an athlete in the past, so I always had that mentality to push. Well, every day is different. It's with this diagnosis. It's one day I can do something that I couldn't do the next day, and then I tried to do the same thing, and it would just be a flop. So there was never a balance, and it's always a roller coaster. So
right.
I have just had to rely on my faith to get me through this, and thank God.
Yes. Wow. No doubt. I actually wrote a book called The Miracle Man. I need to send you a copy of it. You have it? Do you remember the story about the one who was paralyzed?
I haven't started reading it yet. Okay. I just got it.
Okay. Yeah, because it was so funny because, Jesus healed him, and he's going home. Kind of reminds me of you. He goes home, and I know his family was like, what are you doing walking?
Right.
Is that kind of like what it was when you went home and your son?
Yeah, it was. Matter of fact, what's so crazy is when I was experiencing the paralysis in the hospital, and then it was like it did it overnight. And the next morning I kind of woke up and I was just laid on my back. I couldn't move, couldn't turn, couldn't do anything, couldn't sit up, couldn't use my hands. I had to have somebody even help me blow my nose. So it was pretty traumatic. But, I was just laying there just thinking, what is my purpose now? What is my purpose going to be? Because I've always been a caregiver, and that's where my heart is at. I thought that was my calling, and I just felt like the Holy Spirit was just saying, everything's going to be okay. I'm going to be with you through all of this, and you're just going to watch and see my miracles take place. And I was like, okay, so I've held on to that hope, and I believe in miracles, and I'm actually praying that this pump will just disappear and I won't have to have it surgically removed. And I'm trying to get my mentality in that direction anyways, and the faith to believe it to happen. So,
well, he's seen you through this far. He's going to see you through the rest of the way. No doubt about it. I'm
That's right.
so excited. So so she said that you were like, immediately you're like, but let's go to the beach and let's go out to eat.
Yeah, my husband was like, when we were down here the first time, he was like, what has gotten into you? Because I'm usually no energy, brain fog, the whole works. And he didn't know what to do. He didn't know how to handle me. He just was like,
he was tired. Like, he would tell me, like, this is too much. What did you do to her?
He was like, what
you had all this pent up for all these years. It's time to go. It's time to do something.
Yeah, I sit there all day and think about all the things that I want to do and haven't been able to. And buddy, I was ready to go. So I drug all over the place, and he was just worn out by the time we got back.
Oh, that's so wonderful. But he sounds wonderful.
He is. I can't say enough about him or my family. I mean, I don't know what people, how do they do it that don't have the family and the support that I've had? I just think about that all the time. I'm so grateful, so thankful. And my church family actually got me back here to Houston this time, and I'm so thankful for them. So I just want to thank them real quick.
Yay.
It's changed my life. I'm so grateful for you coming on and sharing with your mom, and just meeting Dr. Laura. She is the most compassionate doctor I've ever met in my life. I mean,
Wow.
the first day I was there, she's like, Elizabeth, I'm here for you. If you need anything, you just let me know. You call me, I will be there. And I was like, really?
I
You
know.
know, I've heard, I'm like, okay, but I've never had a doctor tell me that before, and she was. Anytime that I need her, even when I got home, I had some questions or whatever, and she was on the phone calling me back.
Yeah.
You
She's
know,
like Dr. Welby. You
Oh my-
too young to know who I'm talking about. I mean, you know what I'm talking about, right? That's
She's great.
awesome. So thankful. Is there
Yeah.
anything else that you need to tell us? Because I know we probably need to stop, but I'm just so thankful to hear your
Well,
story and share it.
I know Dr. Laura mentioned about when I walk. It's totally amazing. When she was giving me the injections, my legs got wider. I was able to lift my leg. Normally, I'm kind of scratching the surface when I walk. My toes, shuffling, and I was able to pick my legs up. I was able to walk more without a cane down the hallway, even just by myself. It wasn't very pretty, but I did it.
You made it.
So these
She's
little
doing great. She's doing every day. She's doing more and more. I see her in the parking lot, walking around everywhere without her walker, without nothing. The way her legs are working now is so much, like so smooth. And I tell her, you have these basketball legs, and now she's working out at the gym now. Like she's lifting weights with her legs. So this is
Well, I'm thinking you would have lost a lot of your muscle tone over those.
Yeah, I had a lot of atrophy in my legs, and my feet, even my feet. It was so painful to even try to walk on the bottom of my feet. I had a lot of nerve entrapment stuff because of the atrophy, and even my arch had fallen, and so it throws me off balance, and it's just a thing that everything has spiraled out of control. And so Dr. Laura is helping me remove these layers, and I'm just tickled. The circulation, even the color of my legs, they were always real pale and mottled, like really black and purple spots, and white spots, and now they're pink, really pink. My favorite color, our favorite color, but our toes are pink
because you're getting circulation back to your legs.
Circulation back. Exactly. The nerve pain is better. It just blows my mind.
I'm telling you, this is what I talk about, that we are entering into 1,000 years of health, and this is just the beginning. And I'm sure you've heard my videos where I talk about, that our lives begin to extend until they reach 1,000 years.